Hi everyone, this is Dr. Pasunuti Sumanth, consultant pediatrician. This video is regarding the most commonly used medicine for cold and blocked nose in your babies, that is nasal saline drops. Coming to the contents of this video, I will be discussing about when to use these saline nasal drops in your babies and how many times you can use these drops in a single day and how to apply these drops and the possible side effects and also a few handy tips regarding the usage of these drops in your babies. Saline drops are arguably the safest way to treat nasal congestion in infants and babies because they don't contain any medicine. Saline drops also allow you to control the dose more accurately, whereas saline sprays and mists are available but they are best suited in children above 1 year of age. Now we'll see when to use these saline nasal drops. Saline nasal drops are used to treat nasal congestion and dryness. Salt water draws moisture out of the tissues either to reduce the swelling in people with nasal congestion or to increase moisture in people with dry nasal passages. It also helps soften and dissolve crusty mucus plugs so you can remove them. In infants and babies, saline nasal drops can be used to treat nasal congestion caused by common cold, influenza, nasal allergies including allergic rhinitis, sinusitis, respiratory syncytial virus, and other uncomplicated upper respiratory conditions. Now we'll see how often you can use these drops in a single day. If your baby is less than 1 year old, do not use more than 4 times a day, or else use before every feeding. And if your baby is above 1 year, you can use whenever your child nose is blocked or as advised by your pediatrician. Now we'll see how to apply these drops in your babies. First, make sure you have the right tools. You will need sterile nasal drops and also a clean bulb syringe. A bulb syringe is a soft rubber or silicone ball with a narrow cone-shaped tip that can suction mucus from a baby's mouth or nose. First, hold your baby in your lap. The baby should be in an upright or slightly reclined position. Rest the back of the baby's head on your arm as shown in this image. Then, put 2 or 3 saline drops in one nostril and wait a few seconds. This will allow the saline drops to go into the nose. Now, squeeze the bulb end to expel the air by pointing the bulb syringe away from your baby. Then, keep the bulb squeezed and place the small tip in the nostril you put the drops in. Now, gently release the bulb. This will create suction that removes mucus and extra saline from your baby's nose. Then squeeze the bulb syringe into a sink or a cup to expel its contents. Now wait a few minutes. This will give your baby time to calm down if the process was upsetting. And then later on, repeat the same steps in the other nostril also. Do not overdo it. It's best to limit suctioning to not more than 4 times per day. Anything more than this can irritate the nasal passages and cause swelling. Now we'll see the possible side effects of these nasal saline drops. Though saline drops do not contain any medicine, they can cause side effects, particularly if overused. Sneezing, coughing or gagging, nasal dryness if overused, and eye irritation if any drops gets into the eye, and stinging smell if nasal passages are cracked and dry. Handy tips for using nasal drops in babies. If your baby is upset or squirming, have another adult help you. A second person can help keep the baby's head and hands still. Use saline drops before giving the feeds to the baby or after going to sleep. And use a warm washcloth or cotton swab to clean the nostrils after giving nasal drops. Remember, only expel the air in the syringe bulb when it is not in your baby's nose. Bulb syringes can be difficult to clean and may harbor bacteria. Be sure to clean after each use using soap and water. Now we'll see when to take your child to a pediatrician. Sometimes nasal congestion in infants and babies is just the tip of the iceberg. It is important to see a pediatrician immediately if your baby experiences any of the following: trouble breathing despite the clearing of the nostrils, wheezing, rapid breathing and trouble swallowing, sudden drooling, fever over 100 degrees Fahrenheit and fever for any child less than 12 weeks old. These are the symptoms which needs urgent intervention by a pediatrician. This is all about nasal saline drops in babies. And if you have any further queries, please do ask us in the comment section. And thanks for watching.